Hello, everybody. Welcome to the first part of the first PowerPoint dealing with the skeletal system. So we're going to kind of just introduce ourselves to the skeletal system, its functions, properties, things like that, and then we'll get into the first part of the skeletal system that we'll talk about called the axial skeleton. Okay, so let's get into it. So the skeleton can be broken up into two major parts. Okay, we have the axial, which is this bluish purple section, which is going to be the skull, the vertebral column, the rib cage, sternum, and sacrum. And then we have the appendicular skeleton, which is all this pink area, which is anything that hangs off of the axial skeleton. Okay, so those are the two subdivisions of the skeletal system. But what's included in the skeletal system? It's not just the bones. Okay, it's the bones, it's the joints that the bones form. Okay, we need to remember that the elbow is not a bone. Okay, the elbow is a joint where bones articulate or where bones touch each other or move around one another. Okay, so there is a difference between a bone and a joint. It's also going to include cartilage and ligaments, things that hold these joints together and things that protect the bones. Okay, functions of the bones. Okay, they're going to support the body. They're going to protect your soft organs. Okay, we can see here we have a lot of soft organs, the lungs, the stomach, the liver. Okay, kidneys, portions of your kidneys are behind your rib cage. Okay, your skull obviously protects your brain. Your vertebrae protect your spinal cord. Okay, things like that. It allows movement. Okay, we would move a lot differently if we didn't have bones. Like earthworms have muscles, but they don't have bones, so it makes them move a lot differently than us. Our bones are going to store minerals like calcium. Okay, and it's also going to store fats in the medullary cavities. And all of your red blood cells, RBCs, are going to come from your bones. Not your white blood cells; those come from other places, but your red blood cells come from your bones. Your bones make your red blood cells in your marrow. Okay, so if we take a look at this, the adult skeleton has around 206 bones on average. Okay, people who are born, most individuals are born with 206 bones. You could have 207, 208, depending on how the sutures of your skull form and things like that. There are two major types of bone tissue. There is compact bone and there is spongy bone. Okay, if we take a look at this diagram here, this is like a slice or a section of compact and spongy bone. We can see here, this area here is much more dense and compact than this area over here, which is much more porous and spongy. Okay, so we call this compact bone, and then we call this spongy bone. Okay, and we'll get more into that later. Okay, so we can categorize the bones that we have by their shapes. Okay, we have long bones, category number 1, long bones, and that's bones that are typically longer than they are wide. Okay, so your humerus, ulna and radius, your phalanges, femur, tib, fib, phalanges of your feet. Okay, these are all long bones. Okay, they have a shaft, a center shaft, which would be between these two lines. Okay, they have heads at both ends. So here's the head, and here's another head of the humerus. Okay, same thing with the femur. Okay, and most of these bones are compact. The majority of the mass of those bones are compact. Okay, you're going to have compact bones throughout this entire area. You'll have some spongy bone here. You'll have some spongy bone here, but the majority of this bone will be compact. Okay, then you have short bones. Okay, short bones are generally cube-shaped. They contain mostly spongy bone. A good example are the carpals of the wrist and the tarsals of the feet. Your phalanges these are going to be long bones. Okay, these will be long bones, but the tarsals and carpals are going to be short bones. Okay, here's an example of one of the bones of your wrist. If you did if you cut this down the middle sagittally or something like that and looked into a cross section of it, you would see mostly spongy bone inside. Okay. Then you have flat bones. Okay. That's number 3 here, flat bones. These are thin, flat, and usually curved. Okay, so your ribs are a good example of flat bones. Okay, your skull is a good example of flat bones. The sternum is a good example of a flat bone. Okay, and the way these are kind of structured is that you have, so if we took this sternum and kind of tilted it so that it was on its side, and we were looking at it on its side, okay, you would see almost like a Oreo cookie of compact bone on the top, compact bone on the bottom, and then in the middle you would have spongy bone. Okay, kind of like an Oreo cookie where the cream would be the spongy parts and the cookie would be the compact parts. Okay, and then you have number 4, which isn't on this particular slide, but number 4 is going to be the irregular bones. Okay, and the irregular bones are going to be bones that don't fit into any of the other categories. That's typically how it works out. So your vertebrae are going to be irregular bones. Okay. Here is the anatomy of a long bone. Okay, and we want to learn the anatomy of long bones. We have 3 or 2 major sections. You have the ends of the long bones, which are called epiphyses. And one epiphysis is going to be closer to the trunk than the other, and we call that one the proximal epiphysis. Right, so this is a humerus. Okay, this is the upper arm bone. Okay, so this is the proximal epiphysis because this would be where the shoulder is. And this is the distal epiphysis. That's where the elbow would be. Okay, and this would be the shoulder. Okay, so this is the proximal, and these are the distal epiphyses. The epiphyses are going to be spongy bone. Okay, that's where you're going to find spongy bone in a long bone. Okay, you're not going to find spongy bone in the center. You'll only find it in the ends. Okay. In the center, we have what we call the diaphysis. Think of diameter. Okay, so it's the very center here, and it's called the diaphysis. So epiphyses on the ends, diaphysis in the middle. The diaphysis is going to be, it could also be called the shaft. Okay, it's going to be mostly or all compact bone. Okay, you can see here, this is all compact bone, and this is going to go through this entire diaphysis. It's going to be very hard, very dense. Okay, when you break a long bone, you typically break them more often in the spongy areas because they're less structurally sound. The shaft is much, or the diaphysis is much harder, so it's going to be able to withstand a lot more impact. So, but it can be broken, right? Enough force will break the diaphysis of any bone. Okay, you're also going to find what we call the medullary cavity in the diaphysis. The center of this bone is hollowed out. Okay, you have compact bone on the wall, but the center canal is void, and that's going to be what we call the medullary cavity, and that's where marrow is going to be held. And in the diaphysis of a long bone, you have yellow marrow. Okay, yellow marrow is like kind of immature marrow. Okay, the cells here are not ready to be released into the bloodstream yet. The cells are just kind of being formed here. The red blood cells are being formed here, and then they'll move into the spongy bone. This yellow marrow will move into the spongy bone on the epiphyses, and it will become red marrow. Okay, and the red marrow in the epiphyses will then leach into the bloodstream and release these cells, the mature blood cells, when they're ready to go. Okay. We need to know that the ends of the epiphyses are covered in a protective cartilage. It's almost like a shock absorber, and you can see it here. It's this shiny white area here on the distal epiphysis, and it's covering the outside of the proximal epiphysis here. Okay, and we call that articular cartilage. Okay, the word articulate means to touch. It doesn't mean to like speak in like what you would have like in a speech course. Okay, but articular cartilage means that this bone is articulating with another bone. Okay, and in this case, because this is a humerus, this bone is going to be articulating with the scapula. So this section of this bone is going to be touching up against another bone that we call the scapula. Okay, and we don't want these two bones to rub together, right? If these two bones rub together, they cause friction, which can cause bone deterioration, which is what we call arthritis in a joint, and that can cause a lot of pain. So this articular cartilage is there to kind of reduce the friction and absorb shock from forces that this bone is going to encounter. Same thing on the bottom, right? We don't want the ulna and radius to be rubbing up against the humerus and causing, little bone fragments to chip off or anything like that. Okay, and arthritis to occur. So we cover this in articular cartilage. Can the cartilage get worn down? Yes. Can it get damaged? Yes. Okay. And if that happens, you have, health issues with your joints. Okay, and that could mostly be arthritis. Okay, so we did medullary cavity, we did compact bone, we did articular cartilage, did spongy bone. Okay, the two things that are left are the epiphyseal line or the epiphyseal plate. That is called the growth plate. Okay, you can see it here. Okay, so you see spongy, 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 and then you see like kind of like a line here. Okay, that's called the epiphyseal plate. And that's where your growth plate is located, right? Your bones are going to grow from the ends, okay, out. Okay, and that's your growth plate. If you break the bone on the growth plate, you can stunt the growth of that particular bone. Okay, and then lastly, the center of the bone, the diaphysis of the bone, is not going to be covered in articular cartilage. It's going to be covered in something called periosteum, and the periosteum is going to be there to allow for muscle attachments to attach to your bones. Okay, you want a nice solid attachment of the tendons that are at the ends of your muscles to attach to your bones, and the periosteum is going to allow that. The periosteum is always also going to allow for blood vessels to enter the bones, right? We see a blood vessel here, it's entering the bone, and it's going to go through that periosteum, which is that outermost protective covering of the diaphysis of the bone. Okay, here's another close-up of that diaphysis. Okay, again, we can see the yellow marrow inside. This is the yellow marrow. We can see the compact bone. We can see the periosteum here. It's been kind of teased away a little bit so that you can see it. There are little fibers that hold the periosteum to the surface of the bone, and those are called perforating fibers. Okay, here's an artery that's giving the bone nutrients. That's how your bones grow. That's how your bones heal. They get nutrients. Okay. Here's an X-ray of the epiphyseal plates that I mentioned before. I wanted you to see them. You can see this line right below the red line that I'm drawing. Okay, and right above the red line here, you can see that line right down the middle. Okay, that's not a break in the bone. That's called the epiphyseal line. Here you can see it again. You can see it pretty clearly here on the tibia. Okay, this is the femur, and this is the tibia. As you get older and you stop growing, okay, these lines are going to seal up and they'll be unnoticeable. So that's how a doctor can tell if you're still growing or not. If the doctor sees these lines, then he knows or she knows that you are still growing. But if those lines are gone, those lines are kind of sealed up, then your growth is pretty much over as far as your bone size goes. Okay, now these terms, I need you guys to look at these on your own, because I don't want to go through every single one of these, because we only need to know certain ones, but I need you to know the definitions. These are the overall definitions of what we call surface features of bones, or bone markings. Okay, bone markings. So when we go through the different aspects of the skeleton, I'm going to tell you what parts of that particular bone you need to know, right? It's not just memorize that this is a femur. The femur has certain topographical markings that we need to know. This is the head of the femur. This is the neck of the femur. This is the trochanter of the femur. These are the epicondyles of the femur. So we need to know these terms. So I need you to, on your own, either look at this slide and pause it, or go into your textbook and look at the chart in your textbook. But these are all different types of bone markings and their definitions. Okay, so tuberosities, crests, trochanters, their definitions here, they give you examples of each one of these. I'm going to go through these as we go through each bone, right? So if I pull up the femur on when we're going through the bones, and I say I want you to know the trochanter, that's when I'll talk about trochanter. I don't want to waste the time doing it now. I'll do it when we go through the actual bones. But these bone markings, these are going to be projections or processes that grow out of the surface of the bone. They can also be depressions or cavities. And they all have a function, right? Every bump on this bone, every indent on this bone has a name and has a function. Okay, we're not going to learn all of them, but we're going to learn a good deal of them. Okay, this is your pelvis, right? And this little indent here, okay, is very important. That's called your sciatic notch. Okay, and your sciatic nerve goes through the sciatic notch. And if this notch wasn't here, if this was all full up with bone, okay, your sciatic nerve would have to go somewhere else. Maybe your sciatic nerve goes along the outside, and when you sit down, you would pinch that sciatic nerve. Okay, so all of these features are here for a reason. Okay, this hole here in your pelvis, okay, there's a reason that hole is there, right? Muscles go through that hole so that they can attach to different portions of your pelvis so that you can move your legs in a proper way. If that hole wasn't there, the muscle would have to find a different way, and you would move in a different way than you would normally. Okay, so make sure that you go through those on your own, and also when I go through them as well. So here are more of them. Okay, heads, facets, condyles, ramus, meatus, sinuses. I'm going to say all these words when I go through the different parts of the skeletal system, but I need you to do some work on your own and really, get the definitions of these down. So when you take the exam, you know what I'm talking about. Okay. Let's take a look at the microscopic anatomy of a bone, because we need to be able to look at these things on their microscope and know their structure. So what we've done here is we've taken like a slice. We've taken a slice out of a compact long bone. Okay. We've taken a slice out, and we're looking at it a little bit more closely. And we can see that there are lots of different structures here that we need to know. Okay. The first thing we want to know is something called an osteon. An osteon is also known as a Haversian system. A Haversian system is a unit of bone containing a central canal and a matrix of rings. So this whole thing here that I'm circling, this whole thing is an osteon or a Haversian system. So we see one Haversian system, two Haversian systems, three Haversian systems, 4, 5, 6, 7, right? We see lots of Haversian systems here, right? So each one of these large circular portions would be a Haversian system. In the very center, there's a hole, and you can see that here. You can see here the arteries are coming out of it. These little arterioles are coming out of these center holes. Okay, these center holes are called Haversian canals or central canals. Okay, I like to call them Haversian canals. Okay, but they're an opening in the center of the osteon that's going to have a blood vessel and a nerve that goes through them. So this Haversian canal, let me change color so that you can see it. Okay, this Haversian canal, okay, is carrying an artery. Here's another Haversian canal. Here's another Haversian canal. Here's another one and another one. Okay, and all of these different Haversian canals are going to have blood vessels and nerves that come through them. Now, these Haversian canals here and here and here are connected laterally to each other and connected to the other parts of the bone laterally through something called a Volkmann's canal or a perforating canal. Right? We don't want your blood vessels just going straight up and down, because that's going to limit what parts of the bone get the nutrients, right? Because that's what a blood vessel does. A blood vessel gives nutrients that are in the blood to the surrounding tissue. So if the blood vessels are only going in one direction, then we're only going to give certain cells the nutrients. We don't want that. We want all the cells to get the nutrients, all the parts of the bone. So we make these perforating canals that can go sideways through the bone and give those nutrients to every part of the bone. Okay, so those are called perforating canals. They are perpendicular to the central canal, right? So central canals go vertical, perforating canals go horizontal. Here is another picture of just a haversian canal, right? So if you can imagine, this goes in a big circle, right? And this whole thing would be an osteon, right? And we're taking a slice out of the osteon. Okay, so if we go back one, where we're basically taking just a slice of this and looking at it up close. Okay. Here's my haversian canal, right? So this would be the center. There would be a blood vessel coming out of here and a nerve. And then we see these concentric rings going around the haversian canal. It's almost like a tree, right? If you cut it through the bark of a tree or through the center of a tree, you see these concentric rings, and you can kind of tell how old the tree is by measuring how many rings it has. Okay, these are called, let me just get rid of that. These are called lamellae. Okay, each one of these concentric rings is called lamellae. So this is one lamellae, 2, 3, 4, 5, 6, 7, 8, 9 in this particular picture. Okay, and those are just like a tree. When you grow and you get bigger and your bones get bigger, more lamellae are made. Okay, it's not exactly like a tree, but it's very similar. So these lamellae, okay, have these little dark spots, these little spaces in them called lacuna. And these lacuna are going to hold and produce new bone cells. And bone cells are called osteocytes. Okay, anytime you see cyte, it means cell. And anytime you see osteo, it means bone. So bone cell, osteocyte. Okay, erythrocyte is a red blood cell. A hepatocyte is a liver cell. Okay, but these lacuna, here, are going to be the things that hold and produce new bone cells. Okay, so you have your haversian canal surrounded by lamellae. Those lamellae hold lacuna, which are going to produce osteocytes, which are new bone cells. Okay, and that's the microscopic anatomy